Folic acid is a vital nutrient for pregnant women, playing a crucial role in fetal development and neural tube defect prevention. As a brand committed to promoting healthy pregnancies, we recognize the importance of providing accurate information about this essential nutrient. In this video, we delve into the significance of folic acid and its impact on both the mother and the developing baby. During pregnancy, folic acid is necessary for the formation of the neural tube, which eventually develops into the baby's brain and spinal cord. Consuming adequate amounts of folic acid before conception and during early pregnancy greatly reduces the risk of neural tube defects, such as spina bifida. But the benefits of folic acid extend beyond neural tube defect prevention. It also supports the formation of red blood cells and plays a crucial role in DNA synthesis and repair. Furthermore, adequate folic acid intake has been associated with a lower risk of other birth defects, such as cleft lip and palate. In this video, we not only explore the importance of folic acid in pregnancy but also provide practical tips on how to incorporate this nutrient into your daily diet. Whether you're planning to conceive or already pregnant, understanding the significance of folic acid can empower you to make informed decisions for a healthy pregnancy and the well-being of your baby. What is folic acid and its importance in pregnancy? Folic acid, also known as folate, is a B vitamin that is essential for the proper development of the baby's neural tube. The neural tube is a structure that forms early in pregnancy and eventually develops into the baby's brain and spinal cord. Adequate folic acid intake is crucial during the early stages of pregnancy, as this is when the neural tube is formed. Research has shown that folic acid helps prevent neural tube defects, such as spina bifida and anencephaly. Neural tube defects occur when the neural tube fails to close properly during fetal development. By consuming sufficient amounts of folic acid, you can greatly reduce the risk of these birth defects. In addition to neural tube defect prevention, folic acid also plays a role in other aspects of fetal development. It is necessary for the formation of red blood cells, which carry oxygen to the baby. Folic acid also supports DNA synthesis and repair, ensuring proper cell division and growth in the developing fetus. The role of folic acid in fetal development. Folic acid plays a crucial role in the overall development of the fetus. In addition to neural tube formation, it is involved in the development of the baby's heart, brain, and other vital organs. Adequate folic acid intake during pregnancy is essential for ensuring proper growth and development. Folic acid is particularly important during the first trimester, as this is when the baby's organs are forming. It is recommended that all women of childbearing age consume 400 micrograms (mcg) of folic acid daily, even if they are not planning to conceive. This is because neural tube defects can occur very early in pregnancy, often before a woman even knows she is pregnant. If you are planning to conceive, it is recommended to start taking a daily folic acid supplement at least 1 month before trying to conceive. This allows your body to build up sufficient levels of folic acid to support early fetal development. It is also important to continue taking the supplement throughout pregnancy to ensure a steady supply of folic acid. Neural tube defects and their prevention with folic acid. Neural tube defects are serious birth defects that occur when the neural tube, which develops into the brain and spinal cord, fails to close properly during fetal development. These defects can have lifelong consequences for the baby, affecting their ability to move and function properly. However, the good news is that neural tube defects can be prevented with adequate folic acid intake before and during early pregnancy. Research has shown that taking folic acid supplements at least 1 month before conception and during the first trimester can reduce the risk of neural tube defects by up to 70%. It is important to note that folic acid should not be seen as a guarantee against neural tube defects. While it greatly reduces the risk, it does not eliminate it entirely. Therefore, it is still important to follow other healthy pregnancy practices, such as staying active, eating a balanced diet, and avoiding harmful substances like alcohol and tobacco. Recommended folic acid intake during pregnancy. During pregnancy, the recommended daily intake of folic acid increases to 600 to 800 micrograms (mcg). This higher dosage is necessary to meet the increased demands of the developing fetus. It is important to ensure that you are getting enough folic acid throughout your pregnancy to support proper fetal development. There are several ways to ensure you are meeting the recommended folic acid intake. One way is to incorporate folate-rich foods into your daily diet. Foods such as leafy green vegetables, citrus fruits, beans, and fortified cereals are excellent sources of folic acid. Consuming a variety of these foods can help you reach your daily folic acid requirements. Another way to ensure sufficient folic acid intake is through supplementation. Many prenatal vitamins include folic acid, along with other essential nutrients for pregnancy. It is important to choose a reputable brand and follow the recommended dosage. Always consult with your healthcare provider before starting any new supplements. Food sources of folic acid. Including folic acid-rich foods in your daily diet is a great way to ensure you are meeting your daily requirements. Leafy green vegetables, such as spinach, kale, and broccoli, are excellent sources of folic acid. Citrus fruits, such as oranges and grapefruits, also contain significant amounts of this nutrient. Legumes, such as lentils, chickpeas, and black beans, are another good source of folic acid. These foods are not only rich in folic acid but also provide other important nutrients, such as iron and fiber. Fortified breakfast cereals and bread products are also commonly fortified with folic acid, making them convenient options for meeting your daily requirements. It is important to note that cooking methods can affect the folic acid content of foods. To preserve the maximum amount of folic acid, it is best to lightly steam or cook vegetables. Avoid overcooking or boiling, as this can lead to the loss of nutrients, including folic acid. Folic acid supplementation during pregnancy. In addition to obtaining folic acid through diet, many healthcare providers recommend taking a daily folic acid supplement during pregnancy. Prenatal vitamins typically contain the recommended dosage of folic acid, along with other essential nutrients for pregnancy. Supplementation is particularly important for women who may have difficulty meeting their folic acid requirements through diet alone. This includes women with dietary restrictions, such as vegetarians or those with food allergies or intolerances. It is important to discuss your specific nutritional needs with your healthcare provider to determine if supplementation is necessary. Remember, folic acid supplementation should not replace a healthy diet but rather complement it. It is important to continue consuming folic acid-rich foods to ensure a well-rounded intake of nutrients. Folic acid and other prenatal vitamins. While folic acid is an essential nutrient during pregnancy, it is not the only one. Prenatal vitamins are specifically formulated to provide the necessary nutrients for a healthy pregnancy. In addition to folic acid, these vitamins often contain iron, calcium, vitamin D, and other important vitamins and minerals. Taking a prenatal vitamin can help bridge any nutritional gaps in your diet and ensure you are getting the necessary nutrients for both you and your baby. However, it is important to remember that prenatal vitamins should not replace a healthy diet. They are meant to complement a balanced eating plan, not serve as a substitute for it. It is always a good idea to discuss which prenatal vitamin is best for you with your healthcare provider. They can recommend a brand that meets your specific nutritional needs and advise on the appropriate dosage. Folic acid and its impact on maternal health. While folic acid is primarily known for its role in fetal development, it also has important implications for maternal health. Adequate folic acid intake has been associated with a reduced risk of certain pregnancy complications, such as preeclampsia and gestational diabetes. Preeclampsia is a condition characterized by high blood pressure and damage to organs, such as the liver and kidneys. It can be dangerous for both the mother and the baby if left untreated. Research has shown that women with sufficient folic acid intake may have a lower risk of developing preeclampsia. Similarly, gestational diabetes is a form of diabetes that occurs during pregnancy. It can have serious implications for both the mother and the baby. Some studies have suggested that folic acid supplementation may be associated with a reduced risk of gestational diabetes. While more research is needed to fully understand the relationship between folic acid and these pregnancy complications, there is evidence to suggest that maintaining adequate folic acid levels may have a positive impact on maternal health. Folic acid and its long-term benefits for the baby. The benefits of folic acid extend beyond the prevention of neural tube defects and other birth defects. Research has shown that adequate folic acid intake during pregnancy may have long-term benefits for the baby, including a reduced risk of certain chronic conditions. Studies have suggested that folic acid may play a role in reducing the risk of childhood cancers, such as leukemia and brain tumors. Additionally, some research has shown that children born to mothers who had sufficient folic acid intake during pregnancy may have a lower risk of developing asthma and allergies. While more research is needed to fully understand the long-term benefits of folic acid, these findings highlight the importance of ensuring adequate folic acid intake during pregnancy. Conclusion: the importance of folic acid in pregnancy and neural tube defect prevention. In conclusion, folic acid is a vital nutrient for pregnant women, playing a crucial role in fetal development and neural tube defect prevention. Adequate folic acid intake before conception and during early pregnancy greatly reduces the risk of neural tube defects, such as spina bifida. Folic acid also supports the formation of red blood cells and plays a crucial role in DNA synthesis and repair. It is important for overall fetal development, including the development of the baby's heart, brain, and other vital organs. To ensure sufficient folic acid intake, it is important to consume folate-rich foods, such as leafy green vegetables, citrus fruits, and legumes. Supplementation with prenatal vitamins can also help bridge any nutritional gaps. In addition to its impact on fetal development, folic acid may have long-term benefits for the baby, including a reduced risk of certain chronic conditions. Adequate folic acid intake may also have positive implications for maternal health, reducing the risk of pregnancy complications. By understanding the significance of folic acid and taking steps to ensure adequate intake, you can empower yourself to make informed decisions for a healthy pregnancy and the well-being of your baby. Remember to consult with your healthcare provider for personalized advice and recommendations. Thanks for watching.